안녕하세요. 다시 뵙게
Hello,
되어
it's nice to
반갑습니다.
see you again. I'm Huang Rina from Osstem Implant.
지난 시간에는
Previously, we discussed the basic implant surgery kits. Today, let's take it a step further and look at the sinus surgery kits. If you understand the basic kits, today's lecture will help you understand why the sinus surgery kit is needed and in which situations it is used. Now, let's assume that a patient visits the clinic. After reviewing the panoramic image and CT scan, the clinician says, "We will proceed with implant placement along with a sinus lift." In these situations, if you try to prepare everything from memory, you may get confused about what to prepare first. Maxillary sinus surgery may sound intimidating just by its name. But after today's session, I'll help you understand it so you can prepare confidently rather than simply memorizing it. Now, let's briefly go over what the maxillary sinus is. The maxillary sinus is an air-filled space inside the maxillary bone, located just above the upper molars. Although it may appear to be solid bone, it is actually an empty space lined with a thin membrane called the Schneiderian membrane. When placing implants in the posterior maxilla, the position of the maxillary sinus is one of the biggest limiting factors. After a molar extraction, the alveolar bone gradually resorbs while the maxillary sinus expands downward, often leaving insufficient bone height for implants. Therefore, when planning implants in the maxillary molar region, the position and condition of the maxillary sinus must first be evaluated. Inside the maxillary sinus, there is a membrane called the sinus membrane. Since it is not firmly attached to the bone, it can be carefully elevated. Bone graft material is then placed underneath to create sufficient bone height for implant placement. This procedure is called a sinus lift, or maxillary sinus augmentation. The sinus lift procedure is performed using one of two approaches depending on the patient's residual bone height. If the residual bone height is 4 mm or more, a crestal approach through the alveolar ridge is typically used. In contrast, if the residual bone height is less than 4 mm, a lateral approach with a lateral window is selected. At Osstem Implant, dedicated sinus surgery kits are provided for each approach. Today, we will focus on the CAS kit, which is used for the crestal approach. As mentioned earlier, this kit is called the CAS kit. Here CAS stands for Crestal Approach Sinus Kit. Now, shall we open the kit? It looks like there are quite a lot of components, right? Because the CAS kit has many components, it is very important to know where each instrument is placed and where it belongs. So, let's go through them one by one. The CAS kit components are divided into three groups: the CAS drills and stoppers, the hydraulic lifting tools, and the bone graft tools. Now, let's take a closer look at each part. First, let's look at the drills. Here, you can see the drills positioned in the kit. The most important goal of this procedure is to safely elevate the very thin membrane inside the maxillary sinus. Therefore, it is critical to drill only to the level of the residual bone height without tearing the membrane. For this reason, all drills in the CAS kit are designed to be used with stoppers. In sequence, the position is first established using a guide drill, followed by twist drills. The implant site is then widened using the CAS drills. Now, let's go over a part that may be a little confusing. At the top, you can see the implant diameters, and below that, there are two drills of different sizes arranged together. This design allows the drilling size to be adjusted according to bone quality. If the bone is very soft, a smaller drill positioned in the front is used first, and then an implant matching the diameter indicated above is placed. Now, let's take a closer look at the CAS drill. The drill is designed with an inverse conical tip, allowing safer drilling without tearing the sinus membrane. The flute on the side is designed to collect autogenous bone during drilling. Lastly, this lower part is where the stopper is attached. During CAS drilling, except for the initial drill, the procedure is performed at a lower RPM than conventional surgical drilling. The recommended RPM for the CAS drill is approximately 400 to 800 RPM. This helps achieve more controlled drilling while protecting the thin sinus floor and membrane. If the RPM is too high, the sinus floor may be suddenly perforated and the risk of membrane damage may increase. Therefore, it is important to check the RPM during CAS drilling. Now, let's move on to the stoppers. This is where many mistakes occur. If you look closely, the colors are the same. You will notice that stoppers of different lengths are repeated. If you try to memorize the lengths by color, you will definitely make mistakes. Instead, if you look at the side of the stopper, you will see a small number marked on it. This number indicates the actual drilling length exposed when the stopper is attached to the drill. So again, the important reference is not the color, but the number. In addition, there is one more important point. These stoppers are often placed incorrectly not only during surgery, but also during the cleaning process afterward. If sterilization is completed with the stoppers in the wrong positions, and the clinician selects them based only on tray location, problems can easily occur. Before, during, and after surgery, always remember to check the stopper numbers. Also, as you may notice during surgery, the stoppers are extremely light. They are attached to the grooved part of the drill. I am currently wearing extra small gloves, and for those with smaller hands, the glove may get caught or the stopper may be dropped during attachment. This is important with any kit, but especially when handling the CAS kit, it is safer to wear the gloves fully and securely. After drilling is completed, this depth gauge is used to check whether the sinus floor has been penetrated. One important point is that the same stopper used in the previous drilling step must also be attached to the depth gauge. This allows the depth gauge to check penetration safely without excessively pushing the sinus membrane or damaging it. With that, the safety check for the drilling step is complete. Now, let's move on to the hydraulic lifting step. Once the sinus floor has been penetrated using the CAS drill, the hydraulic lifting tool is inserted into the drilling hole, and saline is slowly injected to elevate the sinus membrane. This is the key hydraulic lifting step of the CAS kit. At this stage, a syringe should be prepared. Usually, a 3 cc syringe is used. The most important point here is to fill the syringe with saline without air bubbles. This may be more difficult than expected. Once you know the sequence, it is actually very simple. First, fill the syringe with saline. Then attach the irrigation line to the syringe. Make sure to push it in fully so it does not come loose. When you push the saline through, the air bubbles in the line will come out first. After all bubbles are removed, refill the syringe with saline to complete the preparation. Now, the hydraulic lifting step has been completed successfully. But looking at the CAS kit, didn't it feel like something was missing? That's right. Since the CAS kit is designed specifically for sinus elevation, driver tools for implant placement are not included. Therefore, a separate implant kit is required for the next step. If you open the lower tray of the CAS kit, you will find tools used for bone grafting, including a bone carrier for safely delivering graft material into the sinus and a bone condenser used to compact the graft material. In summary, the CAS kit is used up to the sinus floor penetration and hydraulic lifting steps, while the actual implant placement is performed using the 1-2 taper kit. Now, let's briefly review the sinus lift procedure using the CAS kit one last time. First, the position is marked with a guide drill, and a path is established using a twist drill. Then, the CAS drill is used to penetrate the sinus floor and widen the implant site to match the implant diameter. The sinus membrane is elevated using the hydraulic lifting tool, followed by bone grafting if needed, or implant placement without grafting. In general, the maxilla tends to have softer bone quality, while the mandible usually consists of harder or normal bone. So, when you look at the implant system, you will see type 2, 3, and 4 configurations. Most cases are typically managed with type 3. But if you look at type 4, you will notice that the coronal portion is wider than the apical portion. As the implant is placed, this design compresses the bone as it advances. Therefore, it helps improve primary stability in softer bone. So, when performing sinus surgery, it is helpful to keep in mind that this type 4 body design is also available. Before preparing the planned implant for placement, let me emphasize a few important points once again. The implant is usually packaged like this. Here, you should check the implant system, the surface treatment, and the body type. You should also check whether it is a package with a mount attached, as well as the diameter and length. The same information can also be checked on the back. Even after opening the implant blister, the information is also marked inside. Unlike before, it is written as a code here. In this case, it indicates a TS3 body type. You can see that the implant has a diameter of 4.5 and a length of 8.5 millimeters. Lastly, even just before opening the ampoule, you can still confirm the diameter and length markings. So, to ensure everything proceeds as planned, always make it a habit to double-check. Before opening the ampoule, the first thing you should do to prevent mistakes is this. Please look here. As you can see, the engine is currently set to the RPM used for CAS drilling. The first thing you should do when preparing for implant placement is change the mode. Please switch it to implant placement mode. After switching to implant placement mode, prepare the mount driver. Attach the mount driver to the handpiece. Then open the implant package by twisting it. Hold the implant horizontally. Then engage it until you feel it seat into the hex connection inside. Then, hand it to the clinician in the inverted position to complete the implant delivery step. A common mistake is passing it like this. In some cases, the implant may accidentally fall out, which can become a major issue. When handing over an implant or tool, always remember to keep it inverted. Today, we briefly reviewed when and why the CAS kit is used. The CAS kit is a dedicated kit designed for safe sinus membrane elevation in the crestal approach. And once you understand the location and function of each component, surgical preparation becomes much easier. Please keep in mind the key points I emphasized today. Thank you again.